So I said I wanted to make a bequest to the medical school and a couple other, Department of Psychology, Department of Anesthesiology in Chapel Hill. I'm a triple Tar Heel. I did my undergraduate medical school and even did my residency there. Didn't plan it, just worked out that way. So I'm indebted to UNC on several levels. And so the bequest included all of those. And for the medical school, until they opened this campus, it was just a general to the medical school. When they opened this campus, I wanted it to be designated for this campus. And I wanted to keep it local. So when the building came up, I donated some money, but they didn't need my money, not the kind of money I could give then. And we're talking with Janine about what I could do with this bequest. And then she told me the tuition was about $35,000 a year. That's when I said, wow, that's a lot different from $800. And I know at Duke they're charging $75,000, $80,000. I asked Janine, what's the scholarship situation? She said, oh, they had some small scholarships, but they didn't have any full scholarships. And I was shocked. So I said, okay, put me down for a full scholarship. And so to be able to have this facility here, and they're short of several of the specialties that they have residencies in. Obstetrical care was very, very difficult to get until they opened the residency program here. Now they have the predominant market here. Psychiatrists are incredibly short supply. Hopefully the residency will help with that. And so I hope to see that the MAHEC residency programs will bring general surgeons, shorter general surgeons, especially in the outlying areas. So hopefully those will provide the care that is necessary for the region around Asheville at least. Well, medical school is hard to get in, but even then you have these horrible expenses, and to come out with the kind of debts that I'm hearing, several $100,000 in debt, and depending on your specialty, especially if you're working in the rural areas, the pay is not that great. It's going to take you forever to pay that kind of money off. So I would like to make it easier for people who wouldn't even consider medicine to realize there is a pathway that they can go to medical school and come out debt-free and can practice in a rural area and not have the burden of that debt on the state paid for part of my education. So I wanted, I've always loved North Carolina. It's where I've always wanted to live, so I wanted to pay it back.